Good morning. Welcome to the show. We have a great show planned out for you today. Today is going to be designed for people that either have parents that are aging in the 60 and up category, or it's going to be designed for people that are parents that have children that they are concerned about paying for the rising cost and inflation of long-term care, right? They don't want that burden on their children. So if you guys do find this content valuable, go ahead, like, comment, and subscribe because you are getting advice from a licensed financial professional that will dispel some of the smoke and mirrors and the myths out there. So today's topic is going to be centered around the price of care in Los Angeles. So we're going to be looking at a piece from the government, a piece from the Medicare site, and then a study done by PwC that surveys the essential landscape of long term care. So let's go ahead and let's just jump right into our government site. So let's go ahead and share this with you guys. All right, so as you can see, this is on the long term care site.government. So this is going to be a site that just details some of the odds of having care. So I'm going to go over. I'm just going to highlight this and read this to you guys. So someone turning age 65 today has almost a 70% chance of needing some type of long-term care services and supports in their remaining years. Putting that into perspective of what that really means. So when we go out and buy a home, we buy homeowners insurance, right? But the odds of your house burning down is a 3% chance, right? When we go out and buy a car, we go out and we buy auto insurance. But the odds of us actually totaling that car between now and the time that we pass is 18%. And on the other side is that the odds of you having or needing some type of long term care service is 70%, right? And most people simply do not have a financial professional like myself to guide them through this process, right? To educate them on the care. So going on to the next point here is that the government is actually emphasizing that women need care longer than men, right? And from their research, they find that women need care for just a little bit under 4 years, whereas men will need care for a little over 2 years. So, once again, the topic is the price of care in Los Angeles. So, I'm going to show you some numbers right now. So, let's go over to this here. So this right here is the Gen Worth site. You can actually look for this site yourself on Google as a resource just to see how much care will cost. It calculates some inflation numbers and whatnot. So jumping right in, we have the LA area, LA Metro, and these is going to be the costs, right, from the prior year, right? So here is what we have. This is going to be the annual median cost, right? So median just means another way of calculating average, right? Some is more, some is less. So in-home care, this is when you get to stay in your home and have a nurse come to you to help you with your activities of daily living, dressing, eating, bathing, going to the bathroom, and just moving yourself around. The cost of having a nurse come to your house is about $70,000, right? So if you have an extra $70,000 lying around that you can, toss, then maybe this conversation may or may not really be for you, right? Um, and if you don't mind spending that money, even if you do have it, this conversation may not be for you. But if you want to avoid paying that cost, then keep listening. So the change in inflation, um, the amount of increase, right, for home health care is just under 9%. And looking at the next category, which is assisted living, it's broken down into, two categories. One is just, healthcare, and one is the actual assisted living. So in a facility, you're looking at a little over 60,000 per year. And when we're looking at the full, what most people would understand as long-term care, which is like nursing home, you're looking at just under 110,000 for a semi-private room. And it goes on to note, I'll highlight this right here, that the inflation rate since then, the cost have went up 13%. So I want to take a moment before I go on just to help us all metabolize the information. So the government, per longtermcare.gov, is letting us know that there is a 70% chance that we're going to have a long-term care need, right? And women are going to need care much longer than men, about 4 years, whereas men are going to need a little bit more, about 2 years. And so this is a cost for care in the Los Angeles area. So if we're looking at $70,000 per year, and we need care for, just call, say it, 2 years, we're going to need a pool of money that is about $140,000 in today's value. So if we don't account for inflation, we need $140,000, right? So I'm speaking on this topic because there's it's pretty much a train wreck coming soon, right? Because on one end, your retirement plan could be torpedoed by these expenses, right? What if you need care for 3, 4, or 5 years, right? You just lost just 70,000 times two, three, or four. Just call it $200,000 out of your plan, right? And Medicare, we're going to get to the Medicare part in a second, but Medicare does not cover long-term care expenses like you think. And in a hyper localized sense for California, the state is actually looking at implementing a tax for the people who have not went out and purchased long-term care insurance. The reason why, well, one of the reasons why they're looking at implementing a tax is because if all of our aging population goes on Medicare or Medi-Cal for long-term care expenses, the state will go bankrupt. So the state has to make up that shortfall somewhere. And right now in California, this is your opt out period, right? They're not broadcasting this on just regular outlets, right? So it's up to the people to seek financial professionals, licensed financial professionals, to give them this timed and tailored advice about care. So the numbers are here for you to see. If you want these resources, you can obviously just send me a text if you have my cell phone number, drop a comment, or email me, and I can get all of these resources to you. So moving moving along to the the Medicare portion. So people will say, well, Medicare is going to pay for my expenses, right? And I say, well, au de contraire, here's what the Medicare site is actually saying. So, as you can see, Medicare.gov. So, here's a long short. Let me just highlight this and just read this verbatim, right? You pay 100% for non covered services, including most long term care. I'm not going to go on and read the rest of this site because we're down to the last 4 minutes of the show. Our shows are planned for 15 minutes every Monday at 11 a.m. So we're going to just give you the meat and potatoes, what you need to take from this. So, long, short, Medicare does not cover services of long term care. But there is a caveat, right? There's one thing to see, and that is skilled nursing facilities. So, what if someone says, well, I can, part A will cover the hospital part. And I say, that's true, right? And I'll actually show you this site again from Medicare.gov, skilled nursing care. So, there's a couple things to consider when part A is going to cover this Medicare expense for skilled nursing care. Is Let me highlight this for you. Your doctor has to decide that you need daily skilled care and you must get the care from or under the supervision of skilled nursing or therapy staff. Let's continue on. You must get these skilled services in a Medicare certified facility, meaning if Medicare has not certified that facility, you don't qualify for that benefit. Something else to point out, this is huge right here. This is massive, right? Is that you have to be in the hospital for 3 days. Like you have to be hospitalized for 3 days to even qualify for that benefit, right? And it has to be recuperative, meaning if you have Alzheimer's, you're out of luck. You're on the hook. Let's say for some reason or some way you still do qualify, right? This is going to be this part right here. This is called your cost, right? So days 1 through 20, nothing, no bill is due. You pay for nothing. But as you can see right here, days 21 through 100, you're going to have up to $200 per day of a co-payment. So 200 a day times 30, that's 6,000 a month, right? If my math is right, that's 6,000 per month coming out of your pocket. Days 101 and beyond, you cover all of your cost. So we are down to the last minute of the show. So if you guys did find this interesting or of value, comment, like, subscribe, and stay tuned for more series like this coming soon because for the remaining of the month, I'm doing interviews with some experts, right? That have a assisted living facility and a full-time facility and a concierge that also places people in those facilities. And we're going to tie off the month with Carol Golden. So she's been a professional for over 20 years. She's retired now, but she has a nice bird's eye view that can essentially guide us all through the process. So I'll see you guys all here next week at Monday at 11 a.m. Take care and have a good one.